We've got Crayon featuring Ira Star with Tungazi playing right now. How are you doing? It's exactly 1 p.m. Today's Monday, the 24th of June, 2024. Welcome to Mother and Child. My name is Joyce Jukes, and this is your One Family, One radio station, Super 88.1 FM.
In a land of broadcasting and a time of declining family values, the destiny of great radio rests on the shoulders of Super FM.
And here we are taking our jobs very, very seriously. Good afternoon, Edo State. Welcome to yet another sit-down conversation on mother and child. Now, this show focuses on everything that has to do with mother and child health alongside parenting. And we're lucky enough to partner with the T.Y. Danjuma Foundation on this particular show. And every Monday around this time, you get to hear from medical practitioners and experts in their field regarding our topic of conversation. Today's topic is a tad dark, but it's a talk that needs to be had. We're going to be conversing about causes of under 5 morbidity and mortality in children. I have with me Dr. Gbakeji Joseph, who's a medical officer, and Mrs. Latifa Denike, who's a nurse. Hello, good afternoon.
Good afternoon.
Did I finally get that name right, or did I ruin it again?
You tried.
Thank you so much. It means a lot. Hi, good afternoon. I'm very happy to have you, ma'am. How are you doing?
I'm fine. Good afternoon.
All right, welcome. I'm very excited for this conversation. It's not a kind of conversation you should be excited for, but I'm excited for the knowledge. So I'm going to just pass the baton to the medical officer on sit right now and be wild.
Thank you very much. Just as the presenter likely said, we're talking about causes of under 5 mortality and morbidity. Most times, mortality that happens in children, they are causes of overall health and development in a country. These estimates assess the population health programs and policies that are put in place to contribute to population progression. Also, mortality measures the help to identify specific children that risk of having these deaths in the future. Likely, I also want to talk about mortality on its own. It has to do with the deaths that occurs in population, which is expressed as the number of deaths per 100 people per year. Also, morbidity has to do with referring to the state of being unhealthy for a particular disease or situation. Then under 5 has to do with children ranging from the age of 0 to 60 months, which transcend to infants has to do with 0 to 28 days. Then the neonates is 0 to 28 days. Infants from the 2nd month to 11 months, to 12 months, while you have the toddlers from 12 months to 24 months. Then you have the preschool children from 36 months up to 48 months. Then you have the school age children, which ranges from 60 months above. Those are the range of people we want to talk about. Then we'll move over to the epidemiology globally. Globally, from the 90s, we see that there has been a downward trend of mortality in children, ranging to 47% in that trend. Though fewer children still die daily, up to 17,000 children die daily since that time. Then also, from those 47% of children that die, 6.6 million children under the age of 5 years died in 2012, mostly from preventable deaths, which has to do with causes like malaria, pneumonia, diarrhea that we see as trivial. All these are things that causes death. Also, likely to chip this in, hypoglycemia, which is low blood sugar in children, is something we don't joke with. These are something that can easily cause death for them as well. Then we can take it down to the sub-Saharan region, which is Africa. 1 in 10 children die before the age of 5. More than 15% of the average you see in the average developed country. Then cone it down to Nigeria as a whole. Over the past 5 years, infants and under 5 mortality rates has remained steady in the sense that 74 and 117 deaths per 1,000 live births occur respectively. So I should break that down. Now, in every 13 newborn born, 1 child dies. That's how bad it is. Then why for an under 5, before they even get to the age of 5, 1 in 8 of them die. They don't even celebrate their 5th birthday, which is very, very poor for our country. That's why we should look more into the health institution, most especially the rural areas, because these deaths occur majorly in the rural areas, and you can see them among the less educated people and those that are very poor, that they feel that they can't access medical care. So then let's come to what a lot of us want to know about, and which is the topic for today, which has to do with the causes of this death. So like the saying goes, common things occur commonly. So we'll talk about the common things first. For neonates, or when I term neonates, I'm sorry, for newborn babies, because I'm using medical term here. Hope I'm permitted. I'll present.
Of course.
Okay.
But remember to break it down. We'll ask you, like you say neonate. I said,
I'm sorry about that. So neonate means newborn babies that are born from 0 to 28 days. Those ones, they easily come down with they are the one majorly affected with all this death, because some persons just play negligence to it and allow it go. So most deaths that you see in affecting the neonates or the newborn are prematurity. You have to see something called birth asphyxia. That's difficulty with breathing, as that, like when my chiefs came last week, when they talked about the golden minutes. I think you can remember that.
yes, sir. That's the first minute after the child comes into the world, and they're trying to get a child to breathe and all that stuff. Yes, I remember.
Thank
Good
you
students.
very much. That's very good. Also, you get to hear about neonatal tetanus. You have to hear about neonatal sepsis. I talked about hypoglycemia just now. That's low blood sugar in baby. Sometimes some parents, when they give birth, initially they don't, especially using the rural area, they don't lactate that instant, and lactation means you don't breastfeed as at that instant, because why the breast milk is not yet coming out from the woman's breast to help breastfeed the baby. So we can't easily get food or for the baby, which has to do with those supplementary foods given for the child. But majorly we could do something else to help, which is giving glucose, as at that time either getting glucose D to help give the babies the sugar to help them stay alive. But sometimes, most of them, they don't get them, so within their sleep they just go gradually. That's how they just go from low blood sugar. Also, neonatal sepsis has to do with, fine, the baby is alive, baby is doing well. At the end of the day, poor instruments or poor sterilization can lead to sepsis and can lead to that neonatal tetanus that I just talked about. Also, applying of cow dung on the cords of baby, which is practiced majorly in the northern part of our country.
So these is, just to interject, you're talking about the causes of infant mortality?
Yes.
All right.
Okay, thank you. Also, there's something that is also very common, which is called jaundice, which has to do with yellowness of the eyes, yellowness of the body. Some people get to see it and they just play it and say, no, this baby is doing fine, and they just let it go. Most of all those things at the end of the day result to brain damage and even result to death in children. So we always give all these death signs to mothers when they come or when they give birth in our facility, Mary and Mother and Child Hospital. We don't joke with that. So I feel these are some of the red flags we always tell our patients. Then why for those for infants to school age, those that are really common in terms of death has to do with pneumonia, diarrhea, malaria, and what we still tend to overlook recently has to do with the hemoglobinopathies, which has to do with sickle cell anemia. It's something that is more common and it's recent. It's the trend of sickle cell anemia, the way it's moving these days, it's getting higher and higher, and it's something we should look into and talk about on a on another topic, because we are not here to talk about sickle cell anemia. Also, vaccine preventable diseases, which has to do with measles, chickenpox, mumps, tetanus, just as I said, whooping cough. And we could talk about cholera because right now cholera is on the rise, and we are being told to watch out for it keenly because of what it can do. It can lead to death within hours, and it's something we'll still talk about. Then we'll talk about the less common causes, which has to do with congenital anomalies, has to do with maybe from mothers who attempt to be elderly and they are giving birth for the first time. Most times they end up coming down having congenital abnormalities in terms of some patients you see having some brain sorry about that, having some brain issues. Some of them come down having a deformed limb or anything, and that's what we are trying to avoid because those can lead to death. Also, cancers as well can lead to death in these children. Tuberculosis, what we have to do with cardiovascular disease, that's the heart. We have some different type called patent ductus arteriosus, which happens during the first once the child is delivered. At the end of the day, there's something that happens. It's supposed to the place is supposed to close up, but it can persist and not close. But if the child is not being taken to the hospital on time and treatment not pass through, can lead to death of that child. Also, what we can see as not common, road traffic accidents can occur once they are on the road traveling or something, and they could have an accident and it could lead to death. Then lastly, HIV as well. HIV and AIDS can be something that can lead to death for a child under 5 years of age. Then also we can talk about the symptoms, common symptoms, or what I term red flags, that once we get to see this, we don't need to waste time. Just come to the hospital. Even go to the rural areas where there are good PHCs that you can see a doctor to quickly see those patients and then make a quickly referral if they can't attend to the patients there. Examples have to do with difficulty with breathing, which can be associated with Bett asphyxia, which can be associated with pneumonia as well. We have to do with cough, fever that is unreceding, is not coming down, yellowness of the eyes, just as I talked about for jaundice, stooling, which is the diarrhea. We have different types. It could be a watery diarrhea. It could be stained with blood, which has to do with dysentery. It could be rice waters too, which has to do with cholera. Just like I said, cholera is something that is currently out in the society, and we've been taught by the government to take keen interest in it. And let's also, convulsion is something that is common. Febrile convulsion, especially for children. We don't want them to have that because why? It can lead to brain damage at the end of the day. And as it goes from there, it could, if it's persistent without the parents bringing the child to the hospital, the child could die from that. Then also poor cry at birth, just like we said the last time, golden minute, vomiting, wheezing, sore throat, running nose, poor suck, even poor cord care. Just like I said, applying cow dump on the cord to like the northerners do. It's a wrong practice. And also, we could move to preventing such event from happening, which has to do with the perinatal nutrition on the prevention, which has to do with good maternal nutrition. Because if the mother is well nourished, those are antenatal care normally the way it should be done, just like coming to marry a new mother and child, where some persons can't afford this treatment. For there we have something called the patient assisted program, where those ladies that can't really get these funds to access good health care can come for a normal birth delivery. You could pay as low as 25,000 naira and you get all the exclusive treatment that requires, and you are all well done. And also, if it requires going into cesarean section, you can also get the maximum treatment you need done with just a small amount of 50,000 naira, and that will be done. With there, you can get good counseling nutrition, and what to do and what to take to prevent such occurrence, and everything can be done properly. Also, we talked about prevention of infection, which has to do with sepsis, which has to do with tetanus. The mother has to take tetanus injections during antenatal period because there are specific range given to prevent any form of infection or tetanus at the end of the day. Most important that I want to talk about is breastfeeding, because there you can't emphasize on breastfeeding in the sense that we know it's not easy for the female. I can ask Joyce if she's a mother. I know it's not easy to give to breastfeed for straight 6 months. I'm not hearing you, please.
I'm not a mother. I don't know how hard or easy it is to breastfeed for straight 6 months.
Okay, but it's not easy. I will commend women on that. You guys try a lot, but there's a very huge difference between breastfeeding your baby exclusively and instead of adding food supplements to it, because it will prevent you from coming to the hospital. You would barely visit the hospital if you do an exclusive breastfeeding. You will prevent diseases such as diarrhea, any such as pneumonia, respiratory tract infections, cough, catarrh, and all those things. You will prevent them. Your child will be well nourished. Your child won't come and looking like a malnourished child, like those having kwashiorkor or marasmus. None of them will happen. But once they are well fed and well breastfed, and everything will be okay. Also, frequent growth monitoring, which has to do with weighing your child frequently. Come to the hospital to check up on your child. It doesn't have to be when it's at the tail end before you run over to the hospital and say, no, I need to come, and you expect magic to happen when you should have prevented most of all those things right from the get-go. Then family planning is very important. Spacing of children, not bringing children into the world without even giving space or having everywhere littered with a lot of children. That would result to even the disease we are trying to even eradicate, cholera. Some of them could have it come home, infect the others, and before you know, the full family is having it, and people are dying before they run to the hospital. Lastly, sanitation is very important. We have to have good environmental sanitations, and this would help eradicate mosquitoes, especially when it comes to malaria, because if you have stagnant waters around the environment, bushes that are not cleared, these are usually breeding sites for mosquitoes, and they can easily come into the house, infect the child, and it could lead to death as well. I would also like to talk about education, which is very key. We really need to educate females, most especially, because giving some examples that some ladies will come into the hospital and they were like, oh, I want my husband first of all give me permission to do this. But if they are really educated and properly trained, and they know the outcome and know the necessity when it comes to their child's life, they will be swift to take action.
But is it taught to them during antenatal that they have these rights? Because these women do not know that they have these rights.
Yes, they have been talked to, and we even encourage them to come with their partners so that they tend to know more and support the woman too, because it's not easy on their part. Then lastly, having a good primary healthcare center where they can easily access a midwife, a doctor, or even a community health worker, so that they can see and manage. If they see that there in their facility they can't really manage, then they refer to a secondary health center to manage that case. And then, because at the end of the day, we want an healthy baby and an healthy mother. Just like the saying go, if you bring a child poor, it means that outcome is going to be poor. But if you bring the child when the child is okay, it means the child will end up being very fine at the end of the day once you finish treating. But once you expect magic and the child is very poor, it's going to end up with the child dying. Then in conclusion, just as the saying goes, prevention is always better than cure. Thank you very much.
All right, thank you so much. That was very insightful. But as the Lord will have it, there were so many words in there that I was like, let me wait so I can ask all my questions. Now, you did mention a lot of causes of infant and toddler mortality. That is dying, right? Let's just be plain. It is dying. Let's not use big words.
Yes.
So we're talking about reasons why children under the age of 5 may die. Just want to put it out there because it's a serious matter. So you mentioned a few reasons. You had things like neonatal sepsis, convulsion, low blood nutrition, the interesting cultural practices like putting cow dung on the cord of the child, jaundice. But what I want us to tackle most importantly is how parents can know that this thing is happening. What would a parent see in their child to know that they are experiencing neonatal sepsis? Or is it only the doctors that can know that a child is experiencing neonatal sepsis? Or the poor nutrition, or they can't get food from the mother's teeth at that point? We're going to give them something. Can parents know a child that has jaundice, especially for early stages? What are some telltale signs for these different things that a parent can notice, especially when it is no longer a neonatal? The child has followed the parent home.
Okay, thank you very much. For just like you said, for neonatal jaundice, we always give our mothers those telltale warning signs that once you see these things, please come back to.
Can we hear those signs right now?
Those signs involve yellowness of the eyes. Once you see that the body of the baby is becoming yellow. Once you see that the child is refusing to suck the way he sucks. The cry is tending to reduce the way it should be. Please.
The cry is reducing. Can you explain that, please?
Cry. The child, the way he cries before, it's not the way he does recently. It has reduced. There are some persons that have high-pitched cry, but at the end of the day, when you just touch them a little, they even barely move or want to cry. Ooh. So with that, it's already a very bad sign. So we don't want it to get to that, because it means that it has even transcended more than the way it is. It's going towards the brain.
So nothing like, this baby don't big, we're not even they cry again. Now big boy now. Nothing like that.
No, we don't want that.
Oh, no.
We don't want that.
And let me add to it, please. You know, when you give birth in a facility, from the 2, there's this test we do. We do this bilirubin test to check the level of the bilirubin of that child. That's to tell you whether the child is having the high bilirubin. When the child have high bilirubin, you know that child is coming down with jaundice. Not really. Sometimes you give birth and the child's skin will be pink, but in the next 2 days you see the child's
color will start coming in.
That's when you notice. So we don't just discharge immediately. That's how we keep the mothers in the hospital. So when from the second day you do that SB, then you know if the child can go home. Because most times you discharge the child, and when they'll come back the next day and you see the bilirubin has gone high more than what you've done before. So that child has already come down with jaundice.
So this issue with, sorry to cut short, this issue with the bilirubin, is it something that happens within the womb, or is it just, the traumatic experience of being born?
Sometimes it happens within the womb, and sometimes during the process of birth.
Wow, that's really interesting. Now let's talk about convulsion. Now, convulsion is something that I've heard all my life. So they begin, they convulse, and then we're going to put spoon for him out. What should a parent actually do if their child is convulsing?
Thank you for that, able presenter. The thing is, please, they should not put spoon in the child's mouth. Okay. It's a wrong practice. The best thing to do is, some of these convulsions, they tend to resolve on their own spontaneously. Ooh. So once you get to see something like that, the child is convulsing, just leave the child. It resolves on its own spontaneously. Then immediately bring the child to the hospital. Then an assessment will be made. We'll know what to do from there. But if you tend to want to take it further by doing all those wrong or harmful practices to the child, it could lead to something that it's actually bad and wrong, that could eventually affect the child much later in life. So it's better you bring the child immediately to the hospital. And you tend to see convulsion rising up when there is fever, when the body is hot. And when you take the temperatures at that time, temperature is hitting the roof of 40 degrees Celsius. Wow. And that's why we advise newborn mothers and mothers that their child is aged 0 to 16 months to always have a thermometer at home. because that will help check. You tell them, okay, check the temperature. Once you check the temperature as at that time, and you see that the temperature is hitting that roof and it resulted to convulsion, please, once it subsides, bring the child to the hospital.
That's really interesting. If you want to ask the doctors, we have 5 more minutes to ask doctors any questions. The text in WhatsApp is 0705 967 6881. That is 0705 967 6881. The calls are 0812 753 6932, 0705 512 9881. and 0705 572 7881. I came across this conversation on X, the app that's now called Twitter, and it was very gut-wrenching for me. So a woman posted a picture, of her baby and said, she has gone to meet the angels, and that the current diagnosis is seeds. And then I went in the comments and I saw other parents say, that's how we lost our angel. She was sleeping quietly, and in the morning she never really got up. So I got really interested in what seeds could possibly be, and I saw some statistics. I saw that in 2019, the total estimated death from seeds worldwide was over 27,000 babies. And it was the first time I'd heard about this thing, and it's apparently sudden infant death syndrome. Is this something that we should worry about? And does it have anything to do with child placement? They seem to consistently claim that the child was suffocated in their sleep, maybe the baby laid on their stomach or on their face. Can we just throw some light and how we can prevent this also as well?
Okay, thank you. Actually, seeds is it's something that is really uncommon per se.
Thank goodness.
It's just something we call in pathology or using in pathophysiology. It's something that is unknown or cannot be
explained. Hence syndrome.
It's something that is bad, but looking at little studies of this made, it has to do with, just as you said, positioning of the baby when they are asleep. Some of them at the end they end up choking up in their sleep because it could lead to from respiratory infections or respiratory distress, which if the babies are not properly placed during when they are laid in bed can lead to their death. Just as he said, the name is also called a crib. This symptom or this sudden infant death is also called crib or cot death. Means that they died in their crib or their on their bed while they were sleeping. Because these days, most times, mothers, we also teach them how to place their babies. Because if you don't place the babies well, it could lead to their sudden demise. Because placing them, they could have eaten as at that time when the mother went to put them up in the bed. That's why we always tell the mother, bop your baby before you put them up in bed to lie. Because they could just have aspirated and you went to put them in the bed. By morning when you wake up, the baby is gone.
Wow. All right, so we have about 1 minute and some seconds left on the clock. I'd love to hear some closing thoughts, some closing remarks, something to both expectant mothers and parents of toddlers and babies. How do we make sure that we see our babies right from when they are welcomed into the world until, they become fully formed adults and they're responsible for themselves? Or at least, if we're being within the scope of conversation, let them at least pass 5 years.
Okay, thank you. Please, it's good to pay attention to your kids because they are gifts from God. The best thing to do is once you notice any little changes or any things that you feel it's wrong with your child, don't hesitate. Don't say, let's watch and see. Let's see if it will go, or run to a church or run to a TBA or run to anybody or a pharmacist or chemist to get medications. The best thing to do is bring your child to the hospital, allow a professional healthcare worker assess the child so that you see your baby up to their children. They will also in turn give you a grandchild as well. So that's the best thing to actually do for both expectant mothers and those that already have kids already.
Fantastic. Thank you so much.
Also avoid self-medication. That's one thing, because this drug work for somebody and they just tell you, I took this drug when I had cough. You don't know if the same type of symptoms, that's what you have. So it's better you go to the health facility where you meet the doctor to diagnose whatever ailment you have, so that they'll treat you properly instead of just going to the chemist or pharmacy and say, I want to get paracetamol. As well as paracetamol, it causes a lot of damage to the body. So you don't just take drug or abuse drug because you have the access to it. Always seek the medical advice.
That's fantastic stuff. Thank you so much. We've been talking about causes of under 5 morbidity. We had Dr. Joseph and Nurse Latifa Denny here, both from the Mary Hanurage Mother and Child Hospital, right?
Yeah.
Fantastic stuff. Thank you so much for joining us. This is a very eye-opening conversation. Thank you to TY Danjuma Foundation for making this happen. My name is Joyce Chooks. This is your number one... One family, one radio station. If you know, you know. Stick around. Good afternoon, Edo State.